All right, hi gang, we're back. We're moving on to the knee joint. So you can see our skeleton back there, the knee joint. We're going to check that out. So we worked all of the muscles around the hip and how the hip moved and what were the muscles that helped to create those movements. And now we're going to go to the knee. So let's start. And the main two movements we're going to look at are knee flexion and knee extension. We will very briefly touch on knee external and internal rotation, but we'll pick up internal and external rotation and mostly external rotation when we are in live sessions together, because it's rare that you are in yoga doing any isolated rotational aspects of the knee. It's usually in combination with the hip, and it's limited. So it's nothing I want you to like stuff your brain in, because your brain's already probably getting real full. So we don't want you to have to worry about that. But it's important to understand from a biomechanics standpoint how the knee and the hip work together in some of the positions like lotus and pigeon. So let's share screen and do, let's review. So let's review the bones of the knee joint. So here, let's back up a little bit. So this is the lower half of our skeleton, right? So the lower limbs. You guys are intimately familiar with this bone here, the bone that makes up the upper portion of the leg. It's known as the femur. And here's the head of the femur, the greater trochanter and the lesser trochanter. This is the shaft. And then you come down here and you have what we call these condyles. So you didn't need to know that. Now, the femur makes connection with the shin bone, right? What do we call this? Do we remember what this is called? The tibia. And then the third component of the knee joint is this bone here, which is called the patella. So there's one on either side. You can feel that. If you grab onto your knee, you'll be able to feel the bone, the patella bone right there, this little round sesamoid bone. And then the other bone that makes up the lower limb is this tiny, or not tiny, but thinner bone than the tibia. It's called the fibula. Oftentimes these two bones of the lower leg are referred to the tib fib as tib fib. So kind of put them together. Okay, so let's take a look at knee range of motion, and we'll just switch screens here. And so here's our knee range of motion. So when we're in full in extension, our leg is straight out. And then when we come into flexion, the knee bends, the heel comes back towards the gluteal muscles and hamstrings. Now, these are arbitrary numbers that are, they're not arbitrary numbers, they're generalized numbers. So when we're full extension, it's technically 0 degrees. Now, there is some general discussion around we're in extension, especially when we're standing. There can be anywhere from 5 to 10 degrees of extension. That's normal for people back. And some of that we can denote as what we call hyperextension. And again, remember, we're going to talk about hyperextension when we get to our live in session persons and we're starting to look at the biomechanics of the body and why it's important to recognize non-clinical hyperextension and how we as yoga instructors can help individuals help with cueing around hyperextension and making sure that people aren't dumping into their joints in an unsafe way. Now, when we look at flexion, so the knee starts to bend back, right? And then heel comes towards the gluteal muscle. Here's full flexion, 35 degrees. This is again an average. Some people have a lot more flexion of the knee there. There's one more thing I want to review. So we'll go back here to the knee and just a real quick, again, overview of the joint, the actual joint. So remember, this is a synovial joint, just like the hip socket. It's a synovial joint. So this is considered a hinge joint. So it hinges, there's a hinging action. And remember, there's a capsule that surrounds this. So an articular capsule that surrounds the entire knee joint. And on the inside of that, it's lined with a synovial membrane, which makes contact with this stuff here. Do you remember what that's called? It's on the surfaces of the bone where bones meet together. Yeah, it's called articular cartilage. And then the synovial membrane releases synovial fluid. So there's a little tiny bit of fluid in this joint here to help with ease of motion. And then we have what surrounds the knee. So remember, we have the ligaments. So we have one on the outside here, which is the LCL, or the lateral collateral ligament. And then one on the inside, which is called the medial collateral ligament. And then we have two in the center, known as the ACL and the PCL, so anterior and posterior cruciate ligaments. And then you have these fibrous sort of round discs, if you will, that sit between the condyles of the femur and the tibia, and they are called the menisci. So meniscus is individual menisci, too. And then those in conjunction, so the shape of the bones, the ligaments around it, the tendons that come in and support the joint structure, which connect to the muscles, which also relate to the muscles, all of that in conjunction gives us the particular range of motion for somebody's body. So now let's go in and look at the muscles that contribute to knee flexion. Here we go. So the main muscles of knee flexion, there's a lot of muscles here, I know, but you already know the main muscles. And the main muscles, well, at least you've probably heard of them, are called the hamstrings. So we're going to zoom in a little bit here. And then we'll talk about some of these synergistic muscles as well, in the actual knee joint and then in this lower limb here. So we'll just start though first with the hamstrings. So the hamstrings, that's comprised of 3 separate muscles. And we'll take the one that's most superficial here on top first. So if you put your hand on the back of your leg and run your hand right down the center line of the thigh, you'll feel and be able to palpate this semitendinosus muscle. So the semitendinosus muscle has a really long tendon that comes down and inserts at the medial aspect of the tibia. So you can see here, it wraps over top of this muscle here. You'll learn in just a second, and connects there. So that's how you can remember that one. And then its origin, all of their origins here are on this, what's this bone here? The ischium, and this is the connective point. It's called the ischial tuberosity, also known as our sit bones. So semitendinosus, and then this one here. Actually, I'm just gonna hide the semitendinosus. And then we have this one here, which is a semimembranosus. So tendinosus was in the middle with the long tendon coming over. This is the more medial hamstring. So this one is the semimembranosus. So it's really thick, got a thick muscle belly, and inserts at the upper portion, the anterior portion on the medial aspect of the tibia. And then we have one more muscle of the hamstring, which is the biceps femoris. And now you'll see when I select it, it doesn't get the whole muscle because there's actually 2 heads of the muscle. So it's a bifurcated muscle at the origin, but then it comes together at the insertion. So you'll see here is the long head, and then here is the short head, and they come together and form the tendon that attaches at the fibula. And for our purposes, you can just know this as this one muscle. You don't necessarily have to worry about this. Now it does, there are a little bit of tiny differences, but nothing that we need to know about. So, and you can see, so they insert at the ischial tuberosity, and then they insert down and cross the knee joint, right? So the tendons cross the knee joint, which gives us where we get the ability to lift the knee up. So I'm going to go back in and add the semitendinosus for us. So we've added that back. And now we'll come down here and look at these synergistic muscles that help. So this big, huge muscle here is called the gastrocnemius. And I'm going to highlight the portion of it known as the medial head. Maybe I will. And then I'm going to come up here and actually highlight all of it. So there's a medial head and a lateral head of the gastroc, just sort of like that biceps femoris that makes up the hamstring. I think I said the hamstring has 3 separate muscles. I hope I did. Just thinking now, I might not have said that. So it's 3 separate muscles that make up this terminology we call hamstring. All right, so here's the gastroc, this 2-headed muscle, and I'm going to hide it first, or hide it, pull it away, and you can see the muscles underneath that we're going to look at. So these are the other 2 synergistic muscles that help with knee flexion. And this one right here is called the plantaris. It's a really interesting muscle. So it's a flat muscle, short belly of the muscle, but really long tendon. So if you can turn it here, you can see it runs the length of the lower limb and it inserts here on the calcaneus, or the top portion of the heel. And then this other muscle here is called the popliteus muscle. Oh, that's not what I want. There's the fibula. And so let's highlight this one. Maybe. Anyway, so this is the muscle that runs in this interesting direction. So it inserts at his own little spot here. There's a groove for it here along the lower portion of the femur, and it wraps around the back of the knee, and it assists in flexion. It also, if you can see the way the fibers run, it also plays with, it also assists in rotation of the knee. So specifically internal rotation of the knee, which we'll kind of peek at at the end of this video. So there's all the muscles that assist. So we have the hamstrings, which are 3 muscles. So the semitendinosus, the more medial one is semimembranosus. So you can remember M medial, M for membrane, membranosus. And then the most lateral one is the bicep femoris. It's got 2 heads to it. And then the plantaris, the popliteus, and then the big muscle that sits here that we know as the calf muscle called the gastrocnemius. And so I'm going to highlight the semitendinosus muscle for us, and we'll go in and look at motion. We'll look at knee flexion. So here is our knee flexion. So as these muscles shorten, it pulls the lower leg up and back. And we'll sort of rotate this around a little so you can see from other angles. And it has a semitendinosus highlighted. And we'll come back around here and then back around here and tilt this down a little bit so you can see. Perfect. All right, so we're going to pause that and go back to our screen. Good. So let's talk about some postures where we have knee flexion. So probably one of the more obvious ones, right, is bow pose. So whether on the floor or standing, or we call it dancer, you have the flexion of the knee, and then you grab and you'll be able to keep and maintain flexion of the knee. Now, if as you go into further variations of bow, that knee actually starts to extend in them. But for our purposes, for looking at dancer or bow, we have the knee bent. The other place that it happens a lot, right? So we have a lot of knee flexion happening are in any lunge position. So when we have the front knee bent, so let me just tilt this a little bit, right? So we have a bend in the The leg that is forward is in knee flexion, right? And also, what's this? Hip flexion. You got it. And then to do the opposite, we go into of knee flexion. So we have this use of the hamstrings here, right? As we're in knee flexion, it's nice. Now we could be in flexion and there's still going to be this shortening of the hamstring, but we could essentially sort of relax that and be more passive. So we want to make sure that we're engaging that. And then remember, what else do we turn on here? These internal muscles, right? So the inner thighs, the adductors. And so we're working that here. I'm kind of in between two different postures here. So let me go into warrior two. So here, bent knee flexion, and we're really working at the, right, the hamstrings are really working there. Good. So when we talk about coming into something opposite of that, so we get this lengthening, anything where we have straight leg does the opposite, right? And one of the key components here, though, is this sort of dynamic versus passive stretch. So I'm going to widen the legs a little bit. So there's this stretch here. And as I come down, I actually can feel a little bit as I find my way through the back of the hamstrings. You can feel maybe more of a stretch as you kind of move into maybe, let's say, like more of a lunge or a skandasana towards the inside, that semimembranosus hamstring muscle rather than the outside muscle as we kind of move with that. So you just play with it and find how movement through really those sit bones through the hips can sort of shift where you're feeling the lengthening or stretching in the hamstrings. Okay, so now let's look at knee extension. So knee extension, right? Leg goes straight, so there's no bend in the knee. Let's check out our anatomy after that. So we'll go to our muscles of knee extension. Now, things get a little bit easier here. You know these guys already. So one of them, you know. And then you probably know the whole term. So the movers of that help allow our leg to go into extension are the quadriceps. And the quadriceps have four major muscles to them, whereas the hamstrings had three, quadriceps are four. So if you feel along the anterior portion of your thigh, you are feeling right into those hamstrings. And the first one we want to start with is this big guy here, which you already know from some of our conversations when it came to hip flexion, right? So this is the rectus femoris, and it crosses the hip joint, which is why it was involved in hip movement, as well as the knee joint. So that's why it contributes to motion in the knee. So that's the rectus femoris. And then we will go on to this lateral muscle here. So this muscle on the lateral portion is called the vastus lateralis. And actually, I'm going to hide the rectus femoris first. So let me fade it first so you can see, because the fourth muscle sits underneath that. And it's the rectus femoris covers really the three muscles underneath it, but mostly that middle one. So now I'm going to hide it. There we go. So we've pulled that away. So now we're looking at the lateral aspect of the upper thigh, and this is called the vastus lateralis. So the vastus is that's on the lateral portion of the upper leg, and you can see it comes down and it inserts, all the tendons insert together in one local spot, and we'll talk about that in just a second. And then the next muscle is one that's right in the middle. So this one is called the vastus intermedius. So these are pretty easy to remember because they're all based on location. So vastus intermedius is the smaller of the four muscles that sits right in the middle underneath the rectus femoris. And then we are going to rotate it here, and then you'll see that this one is called the vastus medialis. So this inner muscle here, on the medial aspect of the thigh. And now you can sometimes, if people have defined quadriceps, as they engage their leg, you can even do it now. You can extend the leg out and put your leg in extension, and you can feel, and you can sort of see they sort of have like a little, I don't know, it's like a little rounding of the muscle on the medial aspect and then on the lateral aspect. And so you can actually feel the edges of the vastus lateralis and the vastus medialis. And we'll do that when we're in person. And then we're going to add back in the rectus femoris here so we can see what the tendons look like. So we've added the rectus femoris back in. And then what I want you to see is that these come together and create what we call this portion. This is called the tendon of the quadriceps femoris. So this makes up this tendon, and then the tendon of the quadriceps femoris connects with what we call the patellar ligament. Now, this often, a lot of times you'll hear this as the patellar tendon, because people sort of, it's a little easier to just imagine that this is one long extended extenuation of the tendon here. It actually is two separate things, but you won't, it's nothing for you to have to worry about or remember. I just wanted to show you. So this lower inferior section where it connects the tibia to the patella is actually the patellar ligament. And then this section here is called the, oops, sorry, I clicked too high on the tendon, is called the quadratus tendon, the quadriceps femoris. So this guy is what makes up the patella tendon, or you could call the patella ligament, it's okay. So that in conjunction with this is what allows for extension of the knee. And so we will highlight the rectus femoris, and we'll come back here and we will look at the motion of extension here, which you have seen, but it's nice to see it now isolated with the quadricep muscles. So here is the extension with the quadriceps being utilized. So there it's in flexion, and now it's an extension. Flexion and extension. And we could rotate this so it looks like the, we can't. So let's keep it like that. There. So all four of these muscles are working along with this tendon and ligament here to create extension. So we'll pause that, go back to our screen. So we'll talk about now, what are some postures where we have extension of the legs, which we kind of talked about already when we talk about flexion, right? So it's just the opposite of flexion. So anything with straight leg, right? Any asana with a straight leg component. So if you're in a lunge again, right? So this time we'll come into warrior one, and you have extension through the back leg here. This is extension, right? So, or you can maybe do mountain pose, and one-legged mountain, and you come up, and then we're going to have extension through the front leg, right? Or we have a warrior three, so we would have extension through both legs, right? And warrior three, as we come down, both the standing leg and the lifted leg are in extension. And then to create length, or the opposite, anything that would have knee flexion, right? So again, dancer or bow on the ground. Even we talked about in one of the other videos, we call it half saddle or fixed firm. right? So you feel that length through the quad, sorry. I'm gonna take my shoes off for that. Um, and again, all of this we'll visit when we are working through the Cambio sequence in person. And so now just real quick, I'll just show you a couple of screenshots here for our internal and external rotation. But again, remember, I don't want you to have to like stuff this in your head. This is more just like kind of some information that can be nice to understand in relationship to the other pieces. So let me get down here. So, right, we talked about this, an internal external rotation of the knee, really rare to have isolated knee rotation without hip rotation in yoga. And like I said, we'll review this when we're together, and likely we'll talk about this in Pigeon, but I just want to show you this. So it is important to know. So the knee can rotate medially, so you can have this internal rotation medially, and then it can rotate laterally, right? So this external rotation or lateral rotation of the knee. And really, a lot of what we see when we're talking about yoga, we do, and not a lot, but in some of the postures, we're a little bit more focused on this lateral rotation. There is some medial rotation, like in fixed firm, where we have this. But what the things that are important there is if we want to be aware of this ligament and makeup of the knee, right? Because as we rotate the knee internally and externally, the ligaments that are medial and lateral take on tension or pressure from those rotations. So if we don't have enough rotation within rotational ability in the knee and we're asking it to do something that it can't, you can have some damage here. And really, like I said, this sort of correlates to what's happening in the hip. So if we have rotation, for instance, we'll talk about it in Pigeon, but you have external rotation, right? There's external rotation of the femur. And then as you come down, you have some external rotation of the knee. And if you're tight in the femur, in the hip, and you don't have as much room to have external rotation, you can start to put pressure on this knee. So we want to make sure that we have an awareness of that when we are getting people into and out of those positions. And you can see here I've listed for you the primary muscles of internal rotation, as well as primary muscles of external rotation. Nothing you have to know, but I think it's important that we touch on it here. And then, like I said, we'll get into when we're in person and sort of connect the dots for each other. Okay, well, that does it for the knee. So remember, major muscle for knee flexion are the hamstrings. You got it. And there's how many muscles with the hamstrings? 3, right? So it's the semitendinosus, semimembranosus, and the biceps femoris. And there's also 3 additional accessory muscles, the gastrocnemius, which we call the calf muscle, the plantaris, which is that long, tiny little muscle with a long tendon, and then the popliteus, which runs in that sort of diagonal fashion on the back side of the knee. And then the major muscles for knee extension are the quadriceps, right? So how many muscles are in the quadriceps? 4. And they are the very top one, rectus femoris. And then what's the one on the lateral portion? Vastus lateralis. What's the one on the medial portion? Vastus medialis. And then what's the one right in the middle that's underneath the rectus femoris? Vastus intermedius. You got it. All right, you guys, in the next video, we'll look at ankle, the joint of the ankle and the muscles that help to move the joint, the ankle joint.